Journal of Psychiatry says it got it wrong when it came to analyzing the numbers in a large study of transgender patients undergoing sex reassignment surgery. Last fall, the journal published the results of the study and found the surgeries improved patients' mental health. But this week, it corrected itself, saying a second look found no improvement. Here now to explain the significance of this is Dr. Ryan Anderson, the William E. Simon Senior Research Fellow in American Principles and Public Policy at the Heritage Foundation. And he's also the author of When Harry Met Sally, Responding to the Transgender Movement. Dr. Anderson, we have here a prestigious journal admitting that they published a piece that incorrectly analyzed the data. How does this happen?
Well, we're all fallen and we're all fallible. So human error is a possibility here. But there's also the possibility that there was a preferred outcome to the study, and so that they wanted the study to say a certain thing. Obviously, we don't know in this particular instance whether this was just an honest mistake or if this was, motivated research, motivated reasoning to lead to a certain conclusion. But we can say that the media didn't report on one of the main findings of the original study, which was that hormonal transition showed no signs of improvement. They only reported on the original study where it said surgery transition showed signs of improvement. And now that claim has been retracted.
The topic is incredibly sensitive and controversial. You talked a little bit about this. Do you think some statisticians just did sloppy work, or was there an agenda at play among the researchers and journal editors? Elaborate a little bit more on that. What do you think? An agenda or just sloppy work? What's your gut telling you?
Well, it's hard to know. It's hard to tell in any particular instance. I don't know these two researchers. I don't know the editors of the journal personally. So I can't speak to motive in this particular case. I can say, based upon the way that the media celebrated the study, the way that it was then used in social media, the way that it's been used to try to say that anyone with a dissenting viewpoint is against science, anti-science, wrong side of history, does show that the cultural moment in which we're living wants to suggest that there's only one allowed conclusion to this question. And the only allowed conclusion is that transition is the best solution. What the biggest data set now shows, and that's what this study uses, the biggest data set now shows that there's no benefits, psychological benefits to patients of hormonal and surgical transition.
What does this study mean for those struggling with gender dysphoria? Should they think twice about surgery?
Oh, of course. People who are struggling with their own gender identity deserve to know the truth. And what the truth is showing, what the science is showing, is that hormonal surgical transition doesn't provide the promised wholeness and happiness that patients are seeking. And so what we need to do is find ways to help patients feel comfortable in their own bodies. We need to be respectful. We need to be compassionate. We also need to be truthful. And so we need to be helping patients who feel uncomfortable in their bodies to once again feel comfortable in their bodies, but not to radically transform their bodies, because that doesn't bring the lasting wholeness and happiness that they seek.
You've noted the correction, but do you see it getting much attention elsewhere? You're bringing attention to it. Are others doing the same?
I have not seen media coverage of the correction in the way that we saw media coverage of the original study. And so that means if you're a parent of a child with gender dysphoria, if you're a patient with gender dysphoria, you remember the original headline that transition is good for you. You don't now know the corrected headline that it actually doesn't bring the promised benefits. That's why it's important what you're doing on CBN to shine the spotlight on the truth of the matter.
What other research would you like to see on the subject of gender reassignment surgeries, Dr. Anderson, and other medical treatments?
Yeah, I think the most important thing right now is to focus on children. Right now, parents are being told that they need to prescribe puberty, that they need to put their children on the prescribed puberty blocking drugs, cross-sex hormones, et cetera, et cetera. That is entirely an unstudied experimental treatment protocol. And so I think in particular, we need more research on what we can do for young people, for children who feel uncomfortable in their own bodies, and how we can help them feel comfortable once again. But we shouldn't be rushing to prescribe puberty blocking drugs and cross-sex hormones. Parents need to know the facts about this as well.
All right, Dr. Ryan Anderson with the Heritage Foundation. Thanks for your time, sir.
Thank you.
And coming up,